into a space where beauty meets authenticity and transformation is not just a possibility, but a promise. I'm absolutely thrilled to introduce you to someone truly special, Dr. Rukmini Vinaya Rednam, the compassionate force behind the countless remarkable transformations in the vibrant city of Houston, Texas. Picture this: every curve, every contour crafted with care and expertise, not just by a board-certified plastic surgeon, but your very own cheerleader for self-discovery and confidence. Get ready to embark on a journey where we explore the art of science of feeling your very best self. This isn't just a podcast. It's your cozy corner of empowerment and inspiration. So pull up a chair, pour yourself a cup of kindness, and let's dive into the Confidence Doc podcast with Dr. Rukmini Vinaya Rednam.
Welcome back to the Confidence Doc podcast. This will be the first podcast of 2025, and we're excited to have you. And we have a very special guest today, Dr. Gabriele Miotto. Welcome to the podcast.
Thank you so much for having me. It's a great pleasure.
So for our listeners, like I said, you are our first guest of 2025. Tell us a little bit about yourself.
Yes, so I am a plastic surgeon in Atlanta, Georgia. I have been here in practice for 8.5 years. I trained originally in Brazil, and then I had to revalidate everything to be able to come and work in the US as a plastic surgeon as well. Have always dedicated my whole career in aesthetic plastic surgery, especially of the face. And I love it. Even just like I went to plastics because of the face, and I do mostly facial surgeries and facial aesthetic procedures in my office. It's here in Buckhead in Atlanta. I am married to a plastic surgeon, and that was the reason I came to the US. Although he doesn't practice surgery anymore, or we have a medical device company, we really share the passion for the specialty, and I think that's how we connected and how I ended up here in the US. And it's a big world in our specialty, and we connect through friends and through meetings, and I think that's lovely. And that's how I'm here.
So I think it's interesting because you're the first guest we've had that had to do basically your residency twice, right? How was that for you? Was that something that you feel like in retrospect you can't believe you did that, or it's something you're like, no, if I had to do it again, I'd do it again?
Yeah, so I came here and I had an opportunity as an international medical graduate to actually, um, I was invited to join the faculty at Emory as an international expert in aesthetic surgery because that was part of what I did in training for their training. I had to do part of the residency again, but I did also a fellowship in aesthetic and oculoplastic surgery, which is what I practice now. I did a postdoc fellowship and a master's in health professions education. I love teaching. When I was 7 years old, my goal was to be a teacher. I always loved teaching, and I would play as a teacher. And then now I'm a teacher of plastic surgery, and it was very interesting to retrain in a lot of things here. But mostly, it was very important to understand the American health system. Things work here in aesthetics, for example, Brazil and the US are the two largest countries for aesthetic surgery. So that is not very different. The patients are actually very similar, although Brazilians are very open about plastic surgery. They actually tell everybody, and it is not really as a taboo as I see sometimes here in the US. Patients are a little more private, but it's very nice to see the evolution of things and the overlapping of things as we emerge in this global community of aesthetic surgery. So the training here was very nice to understand how the differences are and where actually we blend things together. But yes, we never stop learning. Even like him, we have to go back to training. You have to go back to learning a new operation. You have to back and evolve yourself and your skills. So I see that as part of my own evolution as a person and as a surgeon and learning a new culture. I also was not fluent in English when we met, and that was 17 years ago. So, being fluent in another language and understanding all the subtleties that go with that has been fascinating to me. I'm actually very grateful for all the opportunities that I have had over the time that I've moved from Brazil to here.
Just hearing you speak, I can hear like how passionate you feel about learning and education. And I think you're right. Like as plastic surgeons, we have to actually always be open to learning new things. Otherwise, we don't evolve. And in our specialty, especially if we don't learn new techniques, then we get left behind. We're not providing the best care for our patients.
Yes, correct. And I think it will always be an ongoing thing. So I also mentor a lot of medical students and residents, and they're always, especially medical students, thinking about plastic surgery in general. Even going to medicine, if you don't like learning and evolving, I don't think it's a good profession, because definitely things will be every 5 to 10 years, things change and we need to evolve with it. So to me, being curious, liking to learn, and being open to change, which sometimes we don't like, it is a big thing. And to me, has always opened opportunities. At the first sight, you're just like, oh, okay, I don't want to change again. Why is that? Why do I need to go through all of this? But at the end, if I look back, hindsight is always 2020. So yeah, that was very necessary for so many things. And I think that's lovely if we can keep that perspective, especially going to a new year. Right? There'll be not other opportunities, new changes, new exciting things, but it doesn't mean it's not challenging.
That's true. That's true. Nobody said it was easy. It was,
Nobody said it was easy, but it's worth it.
So you mentioned that you just, you have a passion especially for facial aesthetics. Why is it? Why has that caught your attention more than the other aesthetics areas?
Yeah, so I was in my last year of medical school, and I liked a lot many specialties. I really didn't know, like, what am I going to be? I love all of this. And then I was in a rotation at the emergency department, and I just saw the plastic surgeon put his face back together after this accident. And it was like so much detail and precision, and something that I could never imagine could look normal again. It was looking normal. And I was like, oh my God, it's almost like, I was just like, that's me. Like, I love doing that. I have always been a very detail oriented person. I like the minutia, it's like the meticulousness of the work, and I like working with symmetry. To me, like, I don't know, it's just a very much into, I think about who I am and what I like doing and the skills that comes with me as a person. And I like getting something like that is 80% done into the 100. I always tell my husband, he is like a starter, a big picture guy. He likes getting something from 0 to 80, and then he moves on to another thing. I like the 80, give me the 80 and I'll take it to 100. And I think there is so much like that into facial aesthetics, because millimeters matter. Thrive in that, and I don't thrive in like the big stuff. Like, I don't know, it's just like it's a personality trait, and I recognize that early enough to know that that's who I am, and that I dedicated my focus and efforts into getting better at that, just exploring more of that type of skill, which I think everybody is a little bit different. And for me, if you go with what you have innately in you, things just get easier, or you get more excited. It's joyful to do that type of work. It's not dreadful at all. And for some people, that may be the case, if they are not into what they really like doing.
So that's true because I love big body cases
I
and
know.
people, so other people just hate the idea of doing that.
I know. I was like, no, no, no. Give me the millimeters. And my husband's like you, like, give me the big picture.
Yeah.
Like, I want the big picture. I said, okay, you take it.
But that's why there's something for each of us.
Lovely. Lovely. Yes.
So I have a question for a lot of our listeners. There's a lot of different people surgeons that do facial aesthetics, right? You have oral maxillofacial surgeons, you have ENT trained facial plastics. Can you explain a little bit of the differences between those different types of surgeons?
Yeah, so like you and I were trained in general. Did you train in general
I
surgery
was
too?
actually an integrated resident, so I
Oh,
did, yeah.
yeah. So I trained in general surgery, then plastics, and the plastic surgery training is a very comprehensive training. So we train in all body parts, and we dedicate specific blocks of times for everything. But then you can go and do a fellowship in a specific things. So I did dedicate from the very beginning to the face, and then went and did an oculoplastics fellowship, which deals with the whole eyelid, periorbital area, and aesthetics together, especially of the face. So you can do that for plastics in so many ways, and you can become, a microsurgeon. You can become a hand surgeon. You can become, can dedicate for several things. So, but I dedicate for facial plastics and oculoplastics, which I always loved. And then if you are into the facial plastic route, you do ENT training first, and then you do a fellowship in facial aesthetics. And of course, we never stop learning. So, yes, you do courses, you do so many things afterwards. And for the oculoplastics route, usually, traditionally, they were ophthalmologists just that, did the ophthalmology residency and then did the oculoplastics fellowship afterwards. And we have special societies in the country that certifies surgeons into those subspecialties. I think, plastic surgery to me, I also love breast surgery, and I do very small, specific surgeries in the breast because it's also all about the symmetry. And I just think it's fascinating. There are so many things that we can do as plastic surgeons.
I think it can be sometimes a little daunting for patients, right? Because there are different specialties that overlap, and so sometimes it's the question is, and I will see this come up in question forms and things like that. Oh, if you're going to go to have facial surgery, you should go to a facial plastic surgeon who's ENT trained, and it's I always think about that, and it's kind of what's out there. How do you kind of broach that if somebody comes in and say, you explain, I specialize in facial, but I'm not a facial plastic surgeon in that sense. Has that ever come up? And if it has, how do you explain it?
Well, I think in that I do believe that we get better at what we do the most and what we dedicate our time to learn and perfect and teach and make our knowledge, consolidate our knowledge and expand on it. So I do believe that in within plastic surgery, we dedicate ourselves to subspecialties too, right? So in my case, that's what I have been doing for a decade. And it is, yes, and having specialized and also done a fellowship specifically in the eye area, in the face area, brings you extra skills for that. But I think it is not a general concept because I just need to think about what I think is like, what is the passion of that person? Is that surgeon dedicated to perfecting their craft into a little more of the area that the patient is interested in? I think that actually matters the most. What are the skills? Are the results reproducible over and over for that surgeon? Is that surgeon dedicating themselves to what I'm interested in doing? And do I see the results of that surgeon? Do, do the results resonate with what I see as beautiful, as natural, as what I want to accomplish? Because also we are like apple trees, I say. You know, I am an apple tree. I produce apples. These are my apples, and maybe you're an orange tree and you produce oranges. So if you like my apples, that's what I'm going to create because I do that work. So I think also is related to what is that skill? What like what that surgeon produces, is that consistent? What is the training involved for that person to have been gotten there? Do they teach other surgeons? Do they train other people, and I think that is the most important thing, that where the original training came
Mm-hmm.
from. Does
And
it
I
make
think
sense?
No, I think that makes perfect sense. And I think that's a great way of looking at it. I think sometimes people get very caught up with, oh, if it's eye, you should go to oculoplastics person. If it's this. And I think that you can, each one of those specialties can excel at doing facial plastics. It's really more about, and I agree with you, the reproducibility of your work and the type of details, because maybe you like a certain person's style more than another. So don't get caught up in that only one specialty can do it, because we do have overlap with other specialties, especially in plastics where we take care of the whole body. But yeah, I really like your way of saying that, is like, look at what that person produces. That's more important than getting so caught up in exactly what is their specialty.
Yeah, I think that the training is very important, and what is the experience of that surgeon? But also, is this surgeon someone involved in actually educating other surgeons? And are the results something that appeal to me? And do I see consistency there?
Yeah. And that's where pictures, before and after pictures, and really researching on the doctor that you're going to make a big difference. So, I had the pleasure of seeing you present at a conference not too long ago, and I can tell any of our listeners that the reproducibility and the level of detail of Dr. Miotto's, especially eyelids in that presentation, were just unbelievable. Like, just beautiful, beautiful work. So, what are you excited for in 2025 in what you see? Because every year, facial plastics, there's different trends that come and go, right? I think we can all agree there's certain classic beauty to things, but there's still trends that come and go. What do you anticipate coming in this year?
What I have seen over time is actually patients are very well informed and doing their research more and more into what they want to achieve when they decide to do aesthetic procedure of the face, or either if it's a non-surgical or a surgical procedure. I have noticed that over time, especially patients in their mid to late 40s, they are much more open to surgery because they have realized that the non surgical route, when overdone, while trying to avoid surgery, it's a bad thing. And it actually can put them in a situation that is not going to enhance their beauty or make them look younger. So I think that a trend is, yes, patients are that already see laxity, that already see things that are not treated anymore with non-surgicals the way they used to see. They are much more open to surgery. And while we do, especially for me, I'm always really open to trying to optimize and enhance the healing time, because I think that's a constraint. We're people, people in their 40s usually are really at the height of their careers, and they are busy and they have children and have a lot of things going on, and they want to look the way they feel. They want to look their best. And just fitting a surgery into their busy schedules can be daunting because of the recovery time. So the trend is also, yeah, surgery a little bit early, but also trying to enhance the whole recovery. I do have a very, extensive protocol for before surgery, right immediately after surgery, with like some medications. We do the ERAS protocol, which is then enhanced recovery after surgery, plus some healing supplements. And I do have a hyperbaric oxygen chamber in my office, red light therapy, lymphatic drainage, trying to speed up, the first 2 to 3 weeks. There is, of course, so much we can do, but we can try to offer whatever exists nowadays to help patients heal faster and go back to their lives faster.
Have you, do all of your patients undergo hyperbaric treatment afterwards?
All the ones that do not have a history of claustrophobia, right? Is a tight space, is feels like a little tiny private jet that you go and see for an hour. But patients can work. You can take your phone, your computer, whatever you want in there. It's just really like being in a small space. So I do offer with my surgery package, for especially for the facelifts, a few sessions that we tie with their suture removal days. So they're coming to the office anyways, and they just needs to stay a little bit longer. And for the patients that don't like that idea of being in the chamber, we do then the red light therapy instead. And I also teach my patients to do their own facial lymphatic drainage after surgery. So we kind of just follow the lymphatic patterns in a way that we just try to help the body release all that extra swelling from the faces and necks.
That's great. And it's also the point is surgery is just one part of it. Aftercare is extremely important. And I'm definitely noticing an increasing number of plastic surgeons, not just for facial, but for body as well, who are offering hyperbarics now. I think that that's one of those things where we're always trying to find the best way, not just to heal faster, but to heal better.
To heal better and to optimize modern lifestyle, because yes, we want real results, but we also want to go back to the activities. And I think that's one of the things that I believe there will be more to come. I think there are more things that we can help, add to help our patients heal faster.
So, what are your thoughts on? It seems like there are more women getting younger, like you said, non-invasive things being done younger. What are your thoughts about surgical interventions happening younger? So, happening in the 30s and sometimes even the 20s, because that is definitely happening in places like Turkey.
Yes. I think there are basically two limbs of this. One, I think, like in what I think is happening to younger patients is not necessarily for aging, but for changing in facial shape in a way that will beautify that face. I know things can go all the way, to too far, but mostly, rhinoplasties has always happened earlier. Have always happened earlier, maybe in their early 20s. That is an age, early mid 20s. But now, yes, facial fat grafting can enhance facial features when patients, need a little more. It's like basically instead of filler, patients are doing procedures to enhance their faces a little more permanently in a way of beautifying it. I am not I don't work with this patient population. My patient population is basically women from 40 to 65, and in their 40s that we see even late 30s. Upper eyelid skin starting to build up. I already had mine done. I know you had yours
I've
done.
had my to do.
Start like shutting the eyes down. Like, yeah, eyelid, brow, fat transfer. Those things happen early because it just shows up early. We age first around the eyes, we lose volume from our faces. And I love doing fat grafting, even awake awake in the office, like doing the upper blefts. But then, patients in their mid 40s going through perimenopause, starting to lose collagen in the skin that is visible, laxity, and they also, they just like, okay, I want to reshape. I see that is drupiness, is the scent, but a volume issue, and that needs to be repositioned. So I think it's choosing the right surgery at the right time, and it's different because of genetics, facial shape, whatever sun damage happened, whatever issues happen. So I just think once we have things that we can fix with surgery, and surgery is the best way of fixing that, I think age, then if it is early 40s or late 50s, it's very particular and an individual decision.
And I agree. I think that, people get very nervous with the word surgery, but there's so many procedures in surgery that don't involve, they can be done under local anesthetic or it can be done under sedation. It doesn't always mean something huge, right? Major, exactly. And a lot of times, sometimes when things are asleep, even for a short period of time, the procedure can be done quicker and safer. And so it doesn't always have to be a scary thing. You just have to educate and understand why your surgeon's recommending to do something a certain way.
Yes. Anesthesia is so safe nowadays, and there are so many amazing combinations of anesthetics that will make a patient recover super fast without the downsides of anesthesia, like being sick and things like that. We do a lot of work to prepare the patients the best we can, and it's very rare that someone really is in real pain or has nausea and vomiting after surgery. Rare.
Yeah, like you said, there's just so many newer, better products out there now too. What are your thoughts on? So there, I won't say the devices by name, but there's some devices now that you can use for in place of a blepharoplasty, in place of an eyelid lift. So you use those devices and it heats up the tissue. What are your thoughts on what that is for now and what that is from a long term standpoint?
Yes, so depending on the device, depending on the depth of the heat, that can actually be a bad thing if you decide to do surgery in the future. If a device goes to a range that is in the dermis, for example, is a millimeter or 1.5 millimeters or something like that, it will be reaching the skin, and skin health is always amazing. Okay, so if we do something for the skin, either is to build more collagen, to improve texture, to improve color, wrinkles, it is always going to be good. The problem for surgery is when it goes deeper and goes into the fat layer and things like that. So we start maybe losing fat from the face, or we start creating scar tissue, and because it doesn't really tighten or lifts muscle, which what drops, especially in the jawline or even in the eyes or the brow, you end up having surgery anyways. So we just don't. What I tell my patients, I do have one device, energy device in my office that is very superficial, and I use that to improve the skin quality. So what I tell the patients is like surgery is like tailoring this beautiful dress, and I am the tailor. I'm gonna make this dress fit and lift and shape. But the fabric is your skin. So whatever fabric you bring to me, that's what I'm gonna work with. If it's silk, it's gonna be a beautiful silk dress. But if it's a rugged cotton, whatever, we need to work on that fabric. It's not just the tailoring. So I use the devices, either it's microneedling, ultrasound, and things like that to improve the skin quality. I'm not trying to lift muscle or shape it because it's hard first. You end up having surgery because if it's a muscle laxity or real excess skin, it's not going to contract to the amount that we want and we get with surgery.
That's a really nice way of explaining that. And I think for our listeners, at the end of the day, if something just sounds too good to be true, right? There are some really excellent devices out there, but it's there's rarely you're going to find something that fixes everything. And just like our body and our tissue, our skin is complex, you can't expect one thing to kind of fix everything. And where surgically it becomes difficult, like you said, you have a lot of scar tissue there, and now what was going to be a more straightforward surgery may be much more complex because you lose those planes of dissection that we normally look for when we're doing surgery.
Yes, and another thing that is critical, and I talk with my patients a lot about it, is that even surgery is not permanent. We don't stop aging by surgery. We reset the clock to maybe 5 to 10 years back, and we keep aging. So there are things we need to do to maintain it looking good. The way you manage your life, the way you take care of yourself, the way you eat, the way you protect your skin from the sun, the way you actually sleep. And for women going to perimenopause, are you replacing your hormones? Estrogen is a big engine of collagen production, and then surgery really is a reset, is a refresh. And then yes, if we want to keep looking at a certain way, yes, your Botox will be important. You may need a little filler here and there, or more fat transfer as you lose more during the aging process. So I think education is critical, and there is really not like one and done for anything, because that's just life. We are living and we keep aging.
Everything requires maintenance. It's the we it's amazing that we have skills to be able to offer this, but at the end of the day, there's no quick fix for anything in life. So it's important to remember because a lot of people get so caught up with what they see on social media or they see posts, and it doesn't last forever. But you can certainly do a lot of things to help things last as long as possible and to age well with it.
Yes, and I think also beauty comes from within. We help the external appearance and things like that. And I do see that the patients, even like that, look the best over time. And they are also very happy inside. They are satisfied with themselves and who they are. And is the surgery is just an add-on to the whole thing. It's like a package. Well, there are patients that really get caught a lot into the appearance only, and or will never be that satisfied. But also I try to instruct it and explain and educate patients on that end, because I think also social media, the internet, it can have a lot of m- m- misinformation on what is real and what is not, and that we're a whole being, all connected. It's like the face is not separated from the body and the mind and the way we feel. So if you're feeling bad and you're looking for plastic surgery to fix your life or something, wrong way. Oh well.
In fact, and this is a point I hit on a lot, is that if you're looking for it to fix something, not only you're not going to fix it, you're going to feel even worse, because now you spent money and you did all these things and you still feel just as bad. That's why you always have to be working on your inner happiness, and then the things we do help accentuate it, right, and help bring that out.
Yes, is a lovely add-on. It's like I tell patients too, like if you like your hair a certain way, you're gonna go and do the maintenance with to your grays every, I don't know, for me it's every 7 weeks now. Or even your nails done. Yeah, you go to have your manicure every week or something. Like, yes, it's the same thing. But we have, points in time that we do maybe a major surgery. And yes, we catch up on a lot of the distractions of aging that happens. But definitely, I think it's just important to have realistic expectations.
Oh, definitely, always. Well, Dr. Miotto, thank you so much for joining us. If any of our listeners were hoping to reach out to find you, what are the best ways for them to get in contact with you?
Yeah, so they can find me on my reach out through the website, which is www.atlantaplasticsurgeon.com or drmiotto.com. And then on Instagram and Facebook is at drmiotto, at Dr. Miotto.
And definitely check her out and give her a follow. Her work is absolutely beautiful. So thank you again for joining us on the Confidence Doc podcast. Anything you'd like to leave our listeners with about what you're, like I said, just excited about for the future of facial plastic surgery?
Yes, I think we just need to be number one for me. It will be, if you can, protect your skin from the sun. Use
Yeah.
your eat well, eat your protein, exercise, and then find a good professional to advise you and follow you through your aging journey. I think that's a wonderful thing.
Totally agree. Well, thank you all for joining us for the Confidence Doc podcast. Stay tuned for next week. We'll talk to you then.
As we wrap up another episode of the Confidence Doc, I want to extend our heartfelt thank you for being a part of our community. If today's conversation resonated with you, remember that Dr. Rednam and her team are here to support you on your journey to self-confidence and beauty. Your story is unique, and it's our privilege to help you create the masterpiece that is your life. If you'd like to book a consultation with Dr. Rednam, you can visit her webpage at drrukminirednam.com. Fill out a contact form, and one of her coordinators will get with you accordingly.